Allergic problems are very common, affecting as much as 20% of the population and making people feel miserable for several weeks to many months of the year. Unfortunately, many people don't seek the treatment they need, often because of fear of what will be done to them at the allergist's office. I would like to explain why this really isn't anything to worry about. The most important element of the first visit is an extensive medical history, during which we will talk about such things as what bothers you and what factors might make you feel better or worse. Often, the history, together with physical exam findings, can help determine whether your symptoms are due to allergy, chronic sinusitis, acid reflux, or signs of some other non-allergic disorder. The medical history and exam take about an hour. Many people who come to my office are allergic, and allergy testing is important in determining what is really going on. Not everything is as it seems. One of my favorite examples is a 16-year-old girl I saw a few years ago who developed sneezing and nasal congestion 6 months after getting a cat. But the skin testing showed that this was the time in her life that she developed her dust mite allergy, and the cat had nothing to do with her symptoms. Had her parents assumed that it was a cat and got rid of it, the family would have gone through the heartache of getting rid of a pet, only to find that she didn't get any better. Allergy testing is the best way of measuring what is going on, just like taking your blood pressure if you're on medication for hypertension, or checking blood work if you're taking medication for high cholesterol. If it sounds like your problem is allergic, I'll recommend skin testing or discuss other things we could do if you really don't want to be tested. We're never going to do anything that you don't want us to do. We may also do some lung function testing if you're having breathing issues, and less commonly, I may order some blood work depending on your situation. Testing may take up to another hour, so you should plan on about 2 hours for your first visit. If you think you have allergies or breathing problems, please watch the videos on skin testing and lung function testing for more information about these. After all the testing is done, we'll go over everything. We'll look at what all you might be allergic to, and I may make some recommendations about what you can do to reduce your exposure to your allergens. And don't worry, if you're allergic to your pet and refuse to remove it from the home, there are steps we can discuss that will help. It is best to do something to treat the allergy rather than just ignore it. I will probably recommend some medications, and we'll discuss why I think you should take them and what the possible side effects might be for you. If you would rather not take medications, we'll talk about some other strategies you can pursue to help manage your allergies. Uncontrolled allergy leads to more problems in the future if you don't deal with it. Chronic allergy inflammation leads to sinus problems, frequent infections, and the development or worsening of asthma, so it's very important to figure out what's going on and how best to deal with it. An allergy evaluation is not something you should be afraid of. The testing doesn't hurt, and we'll never do anything you don't want us to. The most satisfying part of my job is getting your quality of life back to what it should be, and I'm looking forward to meeting you. If you have any other questions before making an appointment, please feel free to call my office, and my staff will be happy to help you.